African countries are somewhat on the cusp of a tech revolution, with artificial intelligence taking a mainstay in the financial and health sectors. CNBC Africa spoke to Lizz Ntonjira-Mutuma on how AI is reshaping the healthcare business.
I think for me, what really stood out, especially as somebody within the space of communication and always looking at emerging trends and how AI is shaping the world that we live in, I think one of the things that really stood out was discussions that revolved around using AI for societal benefits. For instance, like the medical breakthroughs and optimizing energy use. I know France is highly advocating for a global platform to foster public interest. AI projects that are independent, that are open access, that are sovereign. I think the fact that they're pushing for more public and private partnerships is something that is good to have a pulse on. I think what also came out of these discussions was around the global AI governance. The summit, I feel, really did do a good job in emphasizing the urgency for global cooperation on AI governance, which we've not seen happen, especially when we're using digital and technological tools. But then it felt like there are different approaches to the regulation that emerged. We could see that the EU is in the process of implementing something that they're calling the Artificial Intelligence Act, while the US warned against overregulation that could really stifle innovation. India has often called, and even from this meeting, called for inclusivity to ensure that AI tools are benefiting broader populations, because we've seen even when we use AI tools, oftentimes they're skewed or biased depending on the information that is fed to them. I think there was also a huge call to investments in AI and also how AI is impacting on jobs. The summit addressed the impacts on this labor market and the need for reskilling and upskilling initiatives through clear policies to manage this transition. And it's really important, especially for Africa, not to be left behind, because this transition, in terms of skills and the gaps that are needed, we still have a long way to go. There was also this issue of emphasis being placed on the ethical AI development and protecting values like copyright and privacy, especially data protection, while we are leveraging clean energy to make AI more sustainable. So it will be really interesting to see how a number of these things that were discussed will be implemented in the near future.
Quite well put, and clearly the future of AI has a lot of aspects when it comes to the legal elements of it. But taking me to my next question in regards to healthcare, we are seeing healthcare is taking center stage in the AI conversation. And perhaps I'd like to know more in terms of what have been some of the best use case for AI adoption in Africa?
Thank you, Abby. I think what I've seen in practice is that a lot of AI tools are transforming the healthcare through the various applications, and the sort of like the end goal has been in enhancing patient care, optimizing operations that are being done within health facilities, and also really driving medical innovation and advancements. We've seen really great benefits around AI enhancing personalized medicine. AI has enabled, we've seen a lot of telehealth coming up, even in Africa. So it has helped telehealth to provide remote consultations, continuous patient monitoring, which especially are beneficial in areas with limited access to healthcare facilities. We've seen AI also come in very handy in disease diagnosis and surveillance. For instance, I remember, because I've been in the global health space, seeing AI-powered diagnostics tools that can be used to enhance accuracy and speed in diagnosing diseases like malaria and diabetes. So sort of using machine learning algorithms that analyze large data sets. So we're able to see which areas and to monitor whether there will be outbreaks in the near future, etc. We've seen AI really help in chronic disease management. I think the watch, maybe a lot of young people or a lot of the watches or mobile applications and tools and wearable devices that people are using have become continuously monitor, like for instance, analyzing sleep patterns to detect the trends and predict potential health events a person may be going through. And these platforms continue to provide real-time feedback to patients and healthcare providers, therefore facilitating timely interventions and adjustments in treatment plans. And we've seen this lead to more proactive management of chronic conditions. I think finally, AI has helped in resource allocation, where it's been used to optimize resource distribution by, for instance, predicting disease outbreaks and streamlining in health facilities, for instance, administrative tasks, such as appointments, scheduling, the triage, etc. So I think we've seen it become more and more used in the healthcare, but there's also a lot that needs to be done in terms of the ethical use of AI, data protection of patient information. There's still a lot to be done, even in the regulatory framework as well, because health